acupuncture, that's something that a lot of folks go to acupuncturists for.
Mm-hmm.
Are there any specific indications of that, or is that just another kind of pain? Or?
It's another kind of pain, yes, but there are also some other common things. Um, for instance, if it's windy and cold out and they tend to get a headache, then it could be wind and cold entering the channels. Those headaches are usually in the back because that's where those Tai Yang channels, the most external channels we talked about earlier, are located. Remember, we protect ourselves at the base of the neck, but then those channels run up the back of the head. And so you tend to get an occipital headache, which is in the back. But then you also could get, for instance, migraine headaches. Those are on the side, temporal headaches. That's usually a liver gallbladder issue because the gallbladder channel runs right back and forth on the side of the head, right above the ear. So that's common. Headaches behind the eyes tend to be, they're like usually throbbing. Those headaches are usually due to hypertension and liver issues, like a liver yang rising. Did I explain liver yang rising adequately? No? So the liver has yin and yang, and remember, yin and yang tend to stay in balance. They balance each other out. When the yin gets depleted, the yin can no longer keep the yang balanced, and then the yang, because it's warm, it's hot, will rise like fire rising up a tree that's burning, right? It rises. And so that's liver yang rising, and then you get symptoms up in the head.
Strength to difference saying liver yin deficiency and liver yang rising?
Yeah, so liver yin deficiency will be earlier, and then liver yin deficiency with yang rising. Like liver yang rising automatically assumes there's yin deficiency, okay. But that's the next step.
That's just a more extreme or powerful.
Yes, exactly, exactly. With I'll give myself as an example. When I was in school, I used to get lots of headaches. And what was I doing? I was using all of my resources up, right? I was using up my qi and my blood. Pancreas qi, because it supports the intellect. Heart blood, because it supports the consciousness. Both of those were getting really depleted as a student. And I started getting more and more headaches. The headaches would have sometimes sharp stabbing pain, qi and blood stasis. Then at other times, I would really love putting pressure on it. And so I started treating myself. I started tonifying qi and blood, and it helped a little bit. I was like, you know what? I'm going to use astragalus root, which is an herb called huang qi in Chinese medicine. Huangqi. Astragalus. Oh, it was with other stuff, yeah. But I added huang qi to my formula. Okay. Huang qi has an upwards moving quality to it. It's also an immune booster. It's in your Jade windscreen. It's the #1 herb in it. As soon as I did that, my headaches got so much better. That's because my qi was getting so deficient that it started sinking a little bit. It wasn't qi sinking so bad that I had prolapse or heavy sagging, but the qi wasn't making it up to my brain. Right? So that's a combination of having both the excessive blood stasis and an underlying deficiency happening at the same time.